Here we go.
All right, so they missed your. So I want to just reiterate what Gillian said and welcome everybody to this webinar. We hope to answer all your questions today, but we know we won't. So we know you'll have some great questions for us that we won't be able to answer. So we'll add those to an FAQ that you will be seeing toward the end of this. So what is this funding opportunity? Simply put, it's a portion of the American Rescue Plan Act funding set aside for training community health workers and medical assistants to combat vaccine hesitancy and to do all the other things that you want, or many of the other things that you are hiring MAs and CHWs for. This is a one-time funding to hopefully that you can get your health professional education and training program off the ground and use it to get something started in your organization that lasts for a long time, well into the future. So I'll turn it back to you, Gillian.
Okay, great. Good job, Judd. So the purpose of this funding is to establish training programs for your community health workers and MAs at your community health center. What we would like to see is that you recruit individuals within your organization or community to obtain a community health worker or medical assistant training and then eventually certification. And these roles will ultimately be used for vaccine promotion and other roles as needed, as Judd stated, and eventually create career paths within your community health center for these roles, and to also retain any community health workers and medical assistants for your community health centers through these positions that through this opportunity that you are creating. So the timeline for this project is that the first step is to attend a live webinar, which we're doing today, or review the recording. After we're done here, we will send out the recording to everyone, to those who may have missed it. And we are asking that you submit your proposal by August 5th, 2022. And the actual funds available could increase if other community health centers do not submit a proposal by the deadline. So every one of you should have received an email with an allocation amount. So that allocation amount can increase if there are other community health centers that decide not to participate. And what will happen is we will send out another allocation email to you so that you would have an exact amount after the August 5th date. So if you all are wondering, again, the proposals for this particular funding opportunity are due by August 5th. If you should need an extension, please feel free to reach out to Judd and I, but we are really pressing the issue that we would like to have all proposals in by August 5th. The next step is that we will review your proposal and provide any changes that we believe that are needed and return them to you. And after agreeing on a final version, PAC will issue a MOA that will reflect your proposal for signature by both parties. And so next we have accepted deliverables. Judd, that's you.
Sure. So there's really two acceptable deliverables for this, and you're going to determine which one it best fits you. I also want to stress that anything that we're putting in here, we're looking for you. You need to put in a proposal that meets your needs and meets your capabilities in your community health center. So one thing you can do is you can recruit people from your community or your surrounding community to come in and be trained as MAs or community health workers to work at your community health center. Or you can use this as an opportunity to promote people from within or give people new opportunities within your community health center to train them for MAs and community health workers. So you have two program goal options here, and you can do both. Actually, maybe it won't help maybe it doesn't work out for you to do just one. You can actually in your proposal you can say you want to take some in as new MAs and CHWs, and some would be promoted from within. Gillian?
Yep. So Judd and I have worked on establishing relationship with educational partners that can be used for this program, but you all are absolutely and you absolutely can decide to use an educational partnership that maybe you already have in place. But we definitely, I'm sorry, I'm getting some kickback. But we definitely did provide, we did establish some relationships with some educational partners, and one of them is Career Steps. Career Step. And the Career Step provides online medical assistant training. Career Step is user-friendly and accredited, so learners can quickly gain the knowledge they need for this medical assistant position, and classes can be taken at any time with this particular programming. Another relationship that we have established and who was on board for this project is the National Institute for Medical Assistant Advancement, NEMA, which many of us know about. NEMA provides on-site training through synchronized audio-visual meetings. Courses are offered through seasonal cohorts, and NEMA follows Pennsylvania's regulations and accreditation standards for medical assistants. Another educational partner that we did bring on board for this project is the AHEC. And AHEC is a Pennsylvania state accreditation program for community health workers, and it's offered in all 7 regions, AHEC regions within Pennsylvania, and it is a 100-hour course for the community health worker. So again, if you all have a local community college or another local technical school that you have already established a relationship with and you would like to utilize that, you are able to do so. Again, we just wanted to provide you all with strong resources in the case that you are starting from the ground up. So one second. The scope of this project, some elements of the program that need to be addressed within your proposal. We need to see that your community health center's ability to participate in either Goal 1 or Goal 2 or both, as Judd stated. We need to see see ways that you will market this opportunity to the people in your community who may be interested and also a good fit for trainings for medical assistants and community health workers. One of the marketing tactics that we have talked about with some of our members is to advertise this educational program on your kiosk or TVs in your waiting areas to just let members of the community, because some of these people that we're serving, some of our patients that we're serving are consumers, may be great candidates for these different roles. We want to see the process that you will use to connect and identify some of your internal staff interested in becoming MAs and CHWs. You will need a project manager to oversee this grant and the progress towards goals 1 or 2, because it's a very large project. So you do want to make sure that you allocate a staff member to that particular role. And then we have a written progress report that is due to us on a quarterly basis, and then a final report when the project is completed, which Judd will talk a little bit about as well in a little bit. So another thing that we pulled out that we thought was important to talk about during this particular webinar is that some staffing suggestions to actually facilitate this program. So one of our community health centers already has this program in place, and so we did pull some of the things that they have used to give you all a better picture of what this may look like. And so program coordinator to basically oversee this whole project, and this person is the primary contact between the educational institution and the community health center. Another role that may be important is a site facilitator who will provide leadership and guidance at the individual training site. Again, one of our community health centers already has a program similar to this one, and they were very hands-on with providing the actual training to the people who were participating. Just one of the site facilitator discussed that one of the mothers was having some issues with some of the learning material, and that she was actually able to be very hands-on in assisting her with her training and the homework and some of the work that she had to turn in. If there's only one training site, the program coordinator could also be the site facilitator as well. Another role that we think will be important is the preceptor is responsible for providing students an opportunity to practice the skills that they have learned through their online coursework. As we all know, some of us are better hands-on learner, and that's where this role would definitely come into place and allow these students to actually have patient visit experience, so that when they are on the floor, that they have they're very confident in the work that they're doing. Again, to go back to some of the financial and progress reporting responsibilities of your community health center, there aren't much, but there are some guidelines that we have put in place. There will be monthly invoicing to PACHC, so quarterly overview reports of enrollment, training programs, who has been successful completing the program, and what are your recruitment and retention rates. And again, Judd will go over that in the appendix. We would like to see your marketing communication with internal and external marketing. Have you done to recruit trainees? And what has the communication been with, what has the communication look like to involve all staff and trainees who would like to participate in this program? The financial responsibility of your center, you will be responsible to purchase all supplies and equipment required for training. You would have to provide the training room space, computers and other technology for training, also compensation for preceptors if specified in your proposal, if that's what your center decides to do, and then funding for accrediting as an apprenticeship is specified in your proposal as well. And some of the responsibility that you would have for selection and onboarding, your center would be responsible for interviewing they would be responsible for interviewing possible participants for the program. You would be responsible for training programs and site coordinators and preceptors, mentors, and also interviewing and selecting students for the program. Okay. So next, Judd, that's you. Is it you yet?
Hey, thanks, Gillian. Are you going to run down through the RFP?
I'll let you do this, and then I'll run through the RFP.
Okay, great. So, there are two appendices to the RFP. And one of the things I want to reiterate that Gillian's already mentioned, but I did want to go back to it very quickly, and that is that for the most part, these are suggestions for how you will run this program. You do not need, for instance, to have the exact staffing people that we listed. Those are suggestions. You will need in your proposal to detail or to give us some indication of who is of the staffing you will be using for this, but that doesn't need to necessarily be those specific staff, those specific job titles. So the appendices, the first I want to mention, well, I'll do Appendix B first, and that is very simple quarterly reporting form. Like your other vaccine hesitancy and other grants you've gotten from us over the past couple years, you will be doing your usual monthly invoicing that you've done in the past. That should not be, that should be fairly straightforward for you. And we'll be working with Julie Cork and her folks to handle that. But the other thing that the Appendix A, there is a requirement that you provide to us a health profession education and training plan. There's a template that we provided to you. This is something that HRSA is very big on right now with these HPET plans. And so we're requiring that you provide us with the plan that could be very extensive, and it could be very targeted on this program alone. But, and you will see that if you haven't seen the Appendix A yet, you'll see that it's pretty straightforward. It's a fill in the blanks sort of thing, and hopefully will help you get not only do this program, but also have a future vision for how you want to be involved in training your workforce there at your community health center. Okay, Gillian, back to you. Back to you, right, Gillian?
Yeah, I'm here. Yeah. So, okay. Sorry, I was busy looking at the chat box and I got sidetracked. Okay. So, 1 second. I'm sorry, guys.
Take your time. So I think next you were going to share your screen with the RFP and run down through that.
RFP. Yeah, I'm looking for it here. I don't know where it went to. Here it goes. Okay, guys, I'm back. So just to we went over a lot of the RFP. So I just want to go over what some of the submission guidelines and requirements will be for the RFP. So submissions are limited to Pennsylvania community health centers, and Philadelphia County sites are excluded from this funding opportunity. Any community health centers that are submitting applications should email a brief letter of intent to me, and Judd can put my email in the chat box, and completed proposals must be submitted by the close of business on August 5th to be considered. Your community health center CEO or executive director or the equivalent must sign the proposal, and all applications must be submitted electronically. The application review criteria should include the relevance of the proposed project to implement the goals referenced in the RFP, the relevance of the outcome measures identified in the application, the appropriateness of the proposed project, and also the qualifications of the individual who will be leading this project as well. Just quickly, as you all, we know that you guys have gotten this RFP and probably looked over it twice, but we just want to go over it so that if you have any questions during this time, you can definitely ask while we're on the call. So one of the first question in the application is, we would need a summary of how the goals 1 and 2 will be implemented. And the summary should include a project goal and how outcome, a high level description of the project activities in the current medical assistant and your current medical assistant and community health worker recruitment and retention activities are at the health center now. The second question is this description of activities. So describe the implementation process in detail and how it would benefit the health center. And this should include the proposed timeline for your implementation as well. So just, draw it out for us, make it simple, but basically just let us know what your timeline would be for this particular project. Number 3 would be a plan for sustaining goals 1 and 2 and the project's impact after the completion of the grant. And then it breaks down how you would sustain program 1 and program 2. And then 4, identify staff members' leads, including program coordinators, staff facilitators, and preceptors, as well as the total number of staff that may be involved in this particular project. Number 5 is identify the educational partner that your health center will utilize, whether it be NEMA, Career Step, AHEC, or your local regional sources that you may already have in place. And then number 6 is a health professions education and training plan. And again, Judd is going to go over that for the appendix. So that is the proposal. It's short, sweet, and to the point. Again, like I said, if there's any questions, please feel free to add them in the chat box. Many of you have also been reaching out to me as well via email, so please continue to do so. That is what I am here for. That is what Judd is here for, to make sure that you all feel confident enough in asking these questions about this proposal. So Judd, I think it's your turn.
Okay, very good. Yeah, and I am getting some stuff in through the chat box. We will resend the RFP and the appendices A and B after this meeting, just to make sure you all have it. Better safe than sorry. Also, there's a question about the project period. It's between now and June 30th, 2024. Funding must be used by June 30th of 2024. So you've got a little over 2 years. A little less than 2 years to get this all spent. Yeah, and we actually are getting some other. Can you move on to the FAQ slide number 11, please, Gillian?
Yep. Can you see it on your slide, guys?
I cannot.
Okay.
I'm stuck on appendices.
Yeah, mine is stuck too. Mine is not moving either. So let me work on this side. But this section,
okay,
is
good. I can work without it. I can fly. I can fly without that. So yeah. The next thing is to talk about is that we are going to do an FAQ sheet, and I have a couple questions that were asked ahead of time that I can run down through. A question we have here right now is that do we required to create training for both MAs and CHWs? No, you are not. It's either or CHWs, and that's the reason why we have 2 medical assistant training come in. And these will be on updated slides. I'm not somehow we updated the slide this morning, and these updates didn't make it in. That's okay. So one of the questions was, if you're already working with National Institute for Medical Assistant Advancement, NEMA, or have another program in place, may you use this funding to build that program? Absolutely, yes. we very much encourage that. If you've already got something in place, use this funding to build that program. We have a question for suggested wages for program coordinators, site facilitator, mentors, and preceptors. We do not have those wage suggestions. As a trade organization, we're not allowed to suggest wages to you. That'd be wage collusion. So we do not have that. But where you can get that from is you can work with NEMA or Career Step or the AHAC folks, and they probably would have suggestions for you on that. Do we have summary descriptions of these roles? We do not, but the educational partner should, and that might be something that we work on if that's something that everybody thinks could be needed. And the last question we had on our FAQ was, could we do a PAC facilitated networking group for participating community health centers? And that's a fabulous idea. I think we could easily do that, and we would learn a lot, and you would learn a lot if we did that. So the answer to that question is yes. And I think with that, Jill, do we want to, the next webinar, we are having a webinar, and you will be getting an invitation to this. A webinar with our partners is July 11th, this coming Monday at 11 a.m. And that is going to be set up, and that invitation, will we get that out today, Jill, that invitation?
Yes. Invitation.
Okay, great.
Today. Yeah.
And Judd, you have some additional questions that have come in?
Okay, thank you. Oh, I didn't scroll down. Okay, so how soon do we need to start the work after the project proposal? That's really up to you. You need to, some of that's going to be, that's got to be part of your plan, is when you plan to do that. There's no requirement on that. I just know that if money isn't spent by June 30th of 2024, it's at least as of this moment, it's going to be gone. Are you expected to hire new staff? No. You can allocate existing staff. What works for you? This is, I mean, I can't say that. We could say that. I want to say that over and over again is what works for you in this program. Everybody's different. So we are trying to make our expectations as general as possible. You need to train community health workers and medical assistants, hire them and use them somewhat for vaccine hesitancy work. And how you implement that is up to you. Do we have any other questions? Anybody want to get on the line and ask Jill or myself any questions? Yeah, there's a question about slides and recording of the July 11th presentation after the meeting. Yes, we'll take care of that. Jill, Monica Deal is asking to give some examples of appropriate fund use. Do you want to tackle that?
You can go ahead and do that, Judd.
Okay. Well, Monica, that is, I'm going to kind of throw that back at all of you and say what you have to use this for is training MAs and community health workers. They can be new people into your organization. They can be current people in your organization who you want to train or retrain as CHWs and MAs. And they have to work on they have to work on vaccine hesitancy. You cannot use this. Inappropriate use would be using this funding to train people in other fields. You can't do that. I'm trying to think of any other inappropriate use. It's got to be used for training community health workers, either new to your organization or people within your organization already. It would be more helpful if you want to come on the microphone and tell us if you're thinking of something, whether we think that would be okay or not.
So my question really is about under the participating community health centers responsibilities, it lays out the training space, the computers, the technology. All of those are supplies that are needed for a successful program. Can this funding be used towards the purchase of those supplies, or that's something that we need to already have in place?
No, you can definitely use it for those supplies. This money can be used for anything that is required for the training. So it can be used for personnel. It can be used for training facilities. It can be used for, if you need to if you have for instance, you have a conference room you want to upgrade and to make it a better learning facility. That's one thing you can do that's going to pay dividends to you going forward. Where you can use that training facility for other things. So as long as you're using it now for training community health workers and medical assistants, that's an investment you can make in the future then that's going to carry forward.
Judd, this is Sherry. Do you want to mention the other flow of funding and how we envision these might be used hand in glove a bit?
Sure. And as you can see in the chat that Gillian's typing in some answers there, so feel free to keep them coming. So we've got another stream of funding that's about $6.5 million that will be used. That we're kicking it off this Friday, the planning for it, and that's a workforce marketing campaign that we're working with Gavin Advertising out of York to develop a lot of materials, a whole marketing campaign for building your workforce and marketing your jobs and branding your community health center as an employer of choice in your community. And those materials are going to be developed, and then you will be that's it. So it's going to end up being about $6.2 million will be distributed to this same group of people. We'll have to have we'll have to have some sort of memorandum of agreement for that too, where you will get this money and you can work directly with Gavin, or you can use your own ad agency in your area, or you can do it on your own, where you can take those materials and market your health center as an employer and market your jobs out in the community. And so one of the things that you can do with that money is that funding should help you market this program. We can't tie them exactly together. We can't combine those funds, but certainly one does feed off the other. So that's pretty exciting news, I think, and it's going to be. We've already started down the road on what that's going to look like, because we're redoing the Career Center website right now and doing some digital marketing for the Career Center coming up soon. And some of the things Gavin has developed, the graphics and some of the taglines and messaging are I think they're spot on. So very excited about that.
Yeah,
hearing more.
This is Kim from PH. I have just a clarifying question, because there was a good bit of background noise as people were joining. We have an existing NEMA program that'll start in the fall cohort, and could you just either confirm or deny that if we are in motion and have this agreement, that can be used to construct the RFP?
I can confirm that. That you can build that right into your RFP. You can, your proposal can say, okay, here's what we're already doing. We're kicking this off. It's going to be in place. We're using NEMA, and we're going to use this money for that. We just need some details on how you're going to do that and where the money's going to go, and then have you report back, send us your invoicing and report back. So absolutely.
Great. Thank you.
Yep.
All right, are we on to the next slide?
I think so.
All right, so our next webinar is Monday, July 11th, 2022, which is next Monday. And during this time, we will have our educational partners on the webinar, and they will be giving a short overview of their program and how their program works and the benefits of their program. And we will also have a community health center. We will have Hamilton Health Center on giving an overview of their current medical assistant training program that they have on site. So again, the webinar is Monday, July 11th, 2022 at 11 a.m. And I will be sending out a go-to invite to you all right after this webinar. So it would be very, probably be very smart and very good if you guys could log on to that. That way, if you have any questions about how these partnerships will work, this would be the time and the place to do so. And then this is our contact information. So I'm sure that you all have that. If you all need to get in contact with me, please feel free to reach out via email or telephone, and Judd's information is there as well. So we have also answered a lot of the questions here in the chat. So I'm going to go ahead and we'll go back out and ask if anybody has any questions.
I just want to add that if you have any doubts about what you're writing in your proposal, please get a hold of us. We're very excited about this program and the potential, and we'd be really excited to talk to you about how we can make this happen. The project period go back to the beginning of this year. No, this is funding moving forward. You can't use this for retroactive funding.
But we may need to confirm that with Department of Health. They have allowed us and some of the other. So I would say answer pending on that one.
Okay.
And the other thing that I would mention is that, as Gillian and Judd mentioned, there is an FAQ with the questions Gillian has received to date. But as you ask more questions, we will add to that FAQ. So your questions will help your colleagues as well.
Absolutely. And again, we're gonna, as like I stated, we will have Hamilton Health Center on the call on Monday, and Melissa Burnett will be able to give an overview of how they started their training program, how many participants that they started their program with, and how they operate their program. And I believe that they use NEMA. And so I think that would be a better example or model of how you can model your project at your community health center if you all have not started yet.
Jill,
Yep.
Just fill them in on who Melissa is and where she works.
Sorry, Melissa Burnett is the, I don't know her title. She is the NEMA instructor at Hamilton Health Center, but also is the workforce development person at Hamilton Health Center. My apologies. And Hamilton Health Center is located here in Harrisburg, Pennsylvania.
And then quick question, how long until the second round of funding comes with the workforce marketing campaign? I'm sorry if I missed that. When are you guys expecting to get that?
Bridget, that's going to be this fall.
In the fall, okay. Because I can kind of see both of these working together, because if you want to increase, people to work as far as MAs, looking for those new people, then the advertising would help.
Right. And let me give you, I will try to, like I said, we're doing a kickoff this Friday, and I'll have a better idea of the timeline at that point.
Okay, thanks.
Yep, you bet.
So if no one has any more questions, we will be sending out that calendar invite here right after this webinar, and we hope to see you all on Monday. Thank you so much for your time and interest for this project.
Thank you all.